The hypothesis that grape peels, particularly those from red and purple varieties, serve as powerful reservoirs of polyphenolic antioxidants with cardiometabolic benefits is well supported by decades of phytochemical and biomedical research. Grape skins are not merely the pigmented exteriors of the berry. They are densely packed with biologically active compounds that contribute directly to vascular health, inflammation modulation, lipid regulation, and metabolic homeostasis. When grapes are analyzed by tissue type, the outer peel consistently emerges as a dominant site of polyphenol accumulation, accounting for as much as 30% of the total phenolic content of the entire berry, while the pulp contributes just 1% or less. The practical implications of this concentration gradient are profound, especially for the development of natural interventions targeting cardiovascular disease and metabolic dysfunction. Among the most notable bioactive compounds in grape peel are anthocyanins such as cyanidin 3-glucoside and malvidin 3-glucoside, which give red grapes their deep coloration and exert potent antioxidant effects. These compounds neutralize free radicals, reduce lipid peroxidation, and stabilize endothelial cells, the thin lining of blood vessels essential for regulating vascular tone and preventing atherosclerosis. Resveratrol, another major constituent of grape skins, has gained considerable attention for its ability to activate sirtuins, enhance mitochondrial function, and mimic some of the cellular effects of caloric restriction, mechanisms tied to extended lifespan and reduced risk of metabolic diseases. Although seeds contain the highest concentrations of polyphenol overall, grape skins remain the most practical and palatable source of many of these beneficial compounds, especially when consumed in whole fruit or wine-based formats. Comparative antioxidant assays, including DPPH and FRAP evaluations, routinely demonstrate that grape skin extracts have 3 to 5 times the radical scavenging power of grape pulp. This is not only a reflection of their total polyphenol load, but also the diversity and bioactivity of those compounds. Grape peels contain catechins, quercetin, camphorol, and procyanidins in addition to anthocyanins, forming a rich antioxidant network with synergistic effects. These molecules have been shown in both animal and human studies to reduce LDL cholesterol oxidation, a key event in the initiation of plaque formation in arteries, and to improve endothelial-dependent vasodilation, thereby lowering blood pressure and enhancing blood flow. When comparing grape varieties, red and purple grapes possess markedly higher peel polyphenol concentrations than white grapes, which lack anthocyanin pigments. This makes dark grape skins particularly relevant in cardioprotective contexts. The Mediterranean diet's association with lower cardiovascular mortality may be partially explained by the regular consumption of red wine, in which grape skin polyphenol are extracted during fermentation. However, the beneficial effects can also be obtained through non-alcoholic forms such as grape peel powder, juice, or concentrated extracts, which are now being studied and commercialized as nutraceuticals. Grape peel polyphenol also show promise in metabolic regulation beyond vascular health. Animal studies have shown that supplementation with grape skin extracts can improve insulin sensitivity, lower fasting blood glucose, and reduce visceral fat accumulation. These benefits are thought to be mediated through multiple mechanisms: reduction of oxidative stress in pancreatic beta cells, improved GLUT4 translocation in skeletal muscle, and downregulation of inflammatory markers such as TNF-alpha and IL-6. Human trials remain limited but encouraging. Some have reported improved endothelial function and lipid profiles after consuming polyphenol-rich grape products. This expanding body of evidence has inspired food technologists and supplement developers to explore new ways to harness the potential of grape peel. One avenue includes the incorporation of grape peel powder into cereals, snack bars, and functional beverages as a way to increase daily intake of flavonoids. Another direction focuses on extracting and purifying resveratrol and proanthocyanidins for use in capsules, cardiovascular support formulas, or as additives in anti-aging skin products. Comparative studies of juices and wines with and without peel exposure further underscore the role of the skin in delivering bioactive potency, with peel-inclusive processing methods yielding products with significantly higher antioxidant capacity and health-promoting potential. Sustainability also plays a role in the increasing interest in grape peels. The wine and juice industries generate large volumes of grape pomace, largely composed of skins, that can be upcycled into valuable nutraceutical products. This approach not only minimizes agricultural waste, but also aligns with clean label and environmentally conscious consumer trends, giving grape peel a dual role as both a functional ingredient and a sustainability solution. In sum, the concentration of polyphenol in grape peels, particularly resveratrol, anthocyanins, and procyanidins, is significantly higher than in the pulp and is closely linked to well-documented cardiovascular and metabolic benefits. Their antioxidant power, anti-inflammatory effects, and impact on lipid and glucose metabolism position grape skins as a highly promising natural tool for the prevention and management of chronic disease. As extraction technologies improve and consumer interest in plant-based functional ingredients grows, grape peels may transition from agricultural byproduct to a central component of future cardiovascular and metabolic health strategies.